Hello, my name is Dr. Vijay Shetty. I head the Department of Anesthesia at the Fortis Hospital, MUL, and it's my proud privilege to have with me Dr. Pankaj Maheshwari, who's the Chief Neurosurgeon and he heads the Euro Services at Fortis Hospital, MUL. He's got an experience of about 25 years in this, and he's known as a master of the holmium surgery, of which we'll probably here today. He's got about 60 international publications. He's extremely busy in the academic space as well. On top of it, he's also the honorary treasurer of the Urological Society of India, which is a big society and consists of thousands of neurosurgeons, many of whom are at the receiving end of academic pursuits of Dr. Pankaj Maheshwari, because he is extremely busy in conducting workshops and training the next generation of neurosurgeons in this difficult art, which is going to provide relief to thousands of patients across India and Asia. Welcome, Dr. Pankaj Maheshwari, and thank you for taking out time from your busy schedule and helping the common people understand more about the prostate. So, at the beginning, at the outset, I'd just like you to help our audience understand what exactly is the prostate gland.
So, Vijay, we need to understand that prostate is basically a male sexual gland. Every man has prostate.
Okay.
Our urinary outlet tube, it goes through the prostate. It is because of the age-related changes or hormonal changes that after the age of 40 years, every man's prostate will start increasing in size.
Right.
We commonly see that our senior generation, they go multiple times to pass urine, they get up multiple times at night to pass urine. They probably take a much longer time to finish their urination and they may struggle to pass urine. That is not age related, it is related to the prostate enlargement. You know, commonly we know that prostate disease is a benign disease. It's a age related change, not cancer. As I've said, every man's prostate will start increasing with age. And say 8 out of 10 patients will have an age related enlargement of prostate. But occasionally there can be a patient who, other than age-related prostate, also has cancer prostate.
Yes.
Sadly, the presentation of both these patients is same. Means both will present with going more frequently to pass urine, taking time to finish urine, straining to pass urine. But it is extremely important as a doctor for us to differentiate whether it is age-related or cancer.
सो डॉक्टर पंकज भाई ने एकदम साफ शब्दों में कहा है कि जो सिम्टम्स रहते हैं वो सेम रहते हैं, भले आपको प्रोस्टेट हाइपोप्लेसिया या हाइपोट्रॉफी हो या कैंसर. तो सर ये थोड़ा विस्तार में बताएंगे कैंसर के बारे में कि किस तरह से आपको पता लगता है कि ये कैंसर है.
सो दैट्स an interesting question. You see, for a patient, it is not possible for him to understand whether it is cancer or age-related prostate. The only way we will be able to diagnose cancer prostate in time is by a regular checkup. So if we can give one message across today, that will be that every man between the age of 55 to 70 years should get a prostate checkup done once in 2 years. And it's a very simple checkup, Vijay. All he needs to do is one clinical examination where with a gloved finger we examine his prostate, feel his prostate. Normally the prostate is smooth and soft in feel. If it is irregular or hard, we suspect cancer. And he needs to do one blood test once in 2 years, which is called as a PSA test.
ओके. तो जस्ट इन जैसे महिलाओं में ब्रेस्ट सेल्फ एग्जामिनेशन बताया जाता है कि रूटीनली किया जाए और उससे हम लोग अर्ली डिटेक्शन कर सकते हैं. डॉक्टर पंकज महेश्वरी साफ तौर पे बता रहे हैं कि इस तरह का कोई सेल्फ टेस्ट मेन के लिए अवेलेबल नहीं है. तो हर 2 साल डॉक्टर्स का विजिट या यूरोलॉजिस्ट विजिट एग्जामिनेशन के लिए और एक ब्लड टेस्ट, जिससे कि उम्मीद है कि अगर वो कैंसर है तो आप डिटेक्ट कर पाएंगे.
बिल्कुल. और प्रोस्टेट कैंसर के बारे में बात करना इसलिए ज़रूरी है क्योंकि प्रोस्टेट कैंसर बाकी कैंसर जैसा नहीं है. प्रोस्टेट कैंसर बहुत ही स्लो कैंसर है और अगर हम इसको सही वक्त पे डायग्नोज करें तो ये करीब 100% क्यूरेबल है. यानी ये इतना स्लो है. क्यों 70 साल की लिमिट डाली गई है टेस्ट करने के लिए? क्योंकि अगर 70 साल के बाद किसी को कैंसर हो भी प्रोस्टेट में तो शायद इस लाइफ टाइम में तकलीफ नहीं देगा. सो इसलिए अगर ये यंग एज में हो तभी ये एग्रेसिव कैंसर है और तभी लाइफ थ्रेटनिंग कैंसर हो सकता है. अगर हम रेगुलर चेकअप करें तो हमेशा कैंसर अर्ली स्टेज में मिलेगा, और अगर अर्ली स्टेज में मिले तो 100% क्यूरेबल है।
क्या ऐसा मुमकिन है कि 50 ईयर से पहले भी ये कैंसर ऑफ प्रोस्टेट नोन है कि?
बहुत अच्छा सवाल है। 50 के पहले भी ये कैंसर हो सकता है कुछ स्पेसिफिक सेट ऑफ इंडिविजुअल्स में। सपोज अगर मेरे फादर को, मेरे चाचा को भी प्रोस्टेट कैंसर रहा है तो मुझे प्रोस्टेट कैंसर जल्दी होने की पॉसिबिलिटी है। अगर मेरा वज़न बहुत ज़्यादा है तो मुझे प्रोस्टेट कैंसर होने की पॉसिबिलिटी है। अगर मैं क्रॉनिक स्मोकर हूँ तो मुझे प्रोस्टेट कैंसर होने की पॉसिबिलिटी है। अगेन कुछ कम्युनिटीज़ है जैसे अफ्रीकन अमेरिकन ब्लैक्स, इनमें प्रोस्टेट कैंसर की पॉसिबिलिटी ज़्यादा है। अब उस एस्पेक्ट को छोड़ देते हैं, पर अगर हम हमारे पेशेंट्स के बारे में बात करें तो अगर आपकी स्ट्रॉन्ग फैमिली हिस्ट्री ऑफ कैंसर है, विच कुड बी प्रोस्टेट कैंसर इन योर फादर, अंकल, बोथ ऑन मैटरनल एंड पैटर्नल साइड, और योर आंट्स हैविंग ब्रेस्ट कैंसर और ओवेरियन कैंसर, अगर फैमिली में कैंसर का हिस्ट्री है तो आप 50 साल की एज में जांच शुरू करें। हाँ, आपका वजन ज़्यादा है, आप क्रॉनिक स्मोकर है तो आपको एज इट इज़ रेगुलर चेकअप बहुत ज़रूरी है। अदरवाइज 55 से 70 काफ़ी है चेकअप के लिए, उसके पहले यूजुअली ज़रूरत नहीं होती है।
क्या ये PSA और क्लिनिकल एग्जामिनेशन हमारे जो नॉर्मल हेल्थ चेकअप्स होते हैं सर, उसमें इज इट अ पार्ट ऑफ दैट एग्जामिनेशन?
Most of the health checkups have this as a routine part. Okay. But you see, I see two extreme types of patients. Patients who get a PSA done every 3 months. Okay, it is not needed. You need to do it just once in 2 years. Or patients who just don't get this test done out of fear. So understand that though we will be talking of cancer, whatever ideas you have about cancer in your mind, they don't apply to prostate cancer. You may think that the moment you have any cancer, you have a restricted life, you need chemotherapy, on chemotherapy you lose hair, you have persistent vomiting, or you need multiple major surgeries. None of this happens with prostate cancer. A lot of patients, I would say 1/3 of patients, even in whom we diagnose prostate cancer, we may decide not to do anything. There is a term called as active surveillance, जहाँ हम पेशेंट पे सिर्फ नज़र रखते हैं। हर साल में उसका चेकअप होता है, हर साल में उसका MRI होगा, क्लिनिकल चेकअप होगा, PSA होगा। ये कैंसर्स इतने स्लो कैंसर होते हैं कि शायद पेशेंट के लाइफ टाइम में ये तकलीफ ही न दे, इसलिए उनमें ट्रीटमेंट नहीं करते। हाँ, अगर कैंसर का ग्रेड ज़्यादा है, अब कैंसर में हमें 2 शब्द समझने हैं। एक शब्द है ग्रेड, ग्रेड मतलब कैंसर की बढ़ने की स्पीड क्या है, और दूसरा शब्द है स्टेज, मतलब इस वक्त कहाँ तक बढ़ गया है। अगर कोई कैंसर हमारा लो ग्रेड है और लो स्टेज है, मतलब धीरे कैंसर है और अभी कहीं फैला नहीं है, तो उस पर सिर्फ नज़र रखी जाती है। हाँ, एक बार अगर उसकी ग्रेड ज़्यादा है, यानी इसका मतलब उसकी बढ़ने की स्पीड ज़्यादा है या ऑलरेडी आज कहीं फैल गया है, तब उसको ट्रीटमेंट की ज़रूरत होती है।
फैंटास्टिक। कि इसको अगर हम लोग ट्रीट नहीं करते कैंसर को, तो जैसे आपने बताया कि उसको दूसरे कैंसर से कंपेयर नहीं किया जा सकता, तो क्या प्रॉब्लम्स हो सकते हैं? सपोजिंग 55-year-old person say has got cancer of prostate, what would be his likely complications as if he is not treated?
So again, let's continue with the same example of 55-year-old man who has cancer. Just telling me he has cancer does not mean anything. Next, I want to know what is the grade of the cancer. If it's a very low grade cancer, then my treatment will be, I will call him every year for a checkup and keep a watch on this cancer. Surveillance. If it is a moderate or high grade cancer, then this 55-year-old gentleman, as you have rightly said, has at least 30 more years to go. So in these 30 years, this high grade cancer has a potential to cause trouble. So if it's a high grade cancer, I would definitely want to treat this cancer. Now in today's time, the treatment of cancer prostate has become very, very simple as far as the patient is concerned. Means, prostate is present inside the deep pelvis at a place where there is hardly any space.
Correct.
So 10 years back, the surgery for prostate cancer used to be a major open operation. Today we have robotic treatments by which the robot gives me access to that deep space inside. I have a 16 times higher vision. My work capacity in that space is much better. So from patient's point of view, the treatment has become very, very simple. Okay. Now, if you don't treat it and if it's a high grade cancer, obviously there is a possibility that this cancer will spread in the surrounding areas or can go to distant areas. Okay. If it goes, prostate cancer is known to preferentially go to bones.
Yeah.
Now, this is one more thing that I would want everybody to understand, that if your senior person in the family has sudden onset backache, don't take it lightly. This could very well be a sign of a advanced prostate cancer.
But this person would also be having urological symptoms, urinary symptoms which he would have neglected. Possible?
Not necessarily. Okay. You see, prostate gland is divided into two parts. One is the central zone and one is the peripheral zone. It is the central zone which causes obstruction and symptoms.
Okay.
The cancer usually happens in peripheral zone. So it is possible that patient may be completely asymptomatic, have no trouble at all, but may still be harboring cancer. So we come again that a regular checkup once in 2 years becomes extremely important.
Are there any specific questions about the sexual activity, whether it leads to prostate cancer, whether it helps in prostate cancer? At the same time, after treatment also, does this any of the treatment options that we discussed, does this affect their sexual output as such?
You know, this is a very, very interesting question. There is a lot of not too scientific literature which says that sexual activity is protective for prostate cancer.
Okay.
So if a person is able to maintain his sexual function for a long time, is regularly sexually active, the possibility of him developing prostate cancer is low. But let's leave that apart. Medically, we would want every person to remain sexually active as long as possible. Remember that if a person can remain sexually active, the risk in his life of, say, heart attack, of brain stroke is much less. Okay. At best, sexual activity can be taken as a form of exercise. Okay. So yes, I would want my patients to remain sexually active, definitely before, if possible after surgery also. Here comes the advantage of robotic surgery. You see, in robotic surgery, the erection nerves are present just behind the prostate. So in patients, if it is possible without compromising the cancer care, we can preserve those nerves and patient may be able to preserve his potency. Okay. Definitely this cannot be guaranteed, but in more than 70% patients probably it will be possible to preserve erection if patient wants, and if based on the disease it is feasible without taking chance with the cancer.
So we also know that you are an expert in holmium laser, and just out of interest, you could just tell a few words about that technique and what is the indication for the holmium laser?
So now you see, as we in the initial part we spoke that prostate has two diseases, cancer and age-related prostate. So robotic treatment is needed for cancer and holmium laser is needed for age-related prostate. So if somebody does not have cancer, just enlarged prostate, which is causing poor flow, increased frequency, getting up multiple times of night, or his urine has stopped, he is getting multiple infections, he has formed multiple stones because of prostate enlargement, then in these patients by holmium laser we can remove the prostate. The biggest advantages of holmium laser are that I can remove any size of prostate. The conventional treatment is called TURP, wherein the prostate is removed by electric current. In TURP, the maximum size that a person will be able to remove is around 60-70 grams. But with laser to remove 300 grams is quite easily possible. A lot of our senior patients are on blood thinning medications. When I do it with holmium laser, I can do this prostate surgery with the blood thinning medications on.
Correct.
And the most important advantage is that after holmium laser surgery, patient will be able to maintain his sexual function. So in today's time, if it's a age-related prostate, treat by holmium laser. If it is cancer, depending on the grade and stage of cancer, if indicated, we can do a robotic surgery.
Interesting. I think it should be clear by now that there are treatment options for prostate problems irrespective of whether they are cancer, where of course you need to be going to expert and seeing if the surveillance is required or surgery or intervention is required. And if it is a hypertrophy, then again There are options where it can be done through a scope without any external incisions and giving you the option of providing a clear flow of urine without any obstruction, and the symptoms will be get relieved, plus you maintain the sexual potency, which has been highlighted by Dr. Maheshwari, that all doctors would want their patients to maintain it as a form of exercise, or the longevity is also